We have Dr. Philip Lee, who's the former Director of Supportive and Palliative Care at the Western Sydney Health District, who's called in. Morning, Philip. Oh, sorry.
Thank you very much for taking my call.
That's okay.
Welcome.
What are you calling about?
Well, I spoke with you several months ago because of a concern that the palliative care ward at Westmead Hospital was closed way back in 2009, and a group of the community advocates have been pushing very hard to have this ward reopened. It was just such a vital part of the hospital infrastructure, and we were getting nowhere. And after approaches to the Minister for Health, Brad Hazzard, he instructed the local health district to undertake a review of palliative care services in Western Sydney. And that review has been completed, and top of the list in the recommendations was to reopen the palliative care ward in Westmead Hospital. And last night, the Chief Executive announced at the Westmead Hospital Medical Staff Council AGM that he had accepted that recommendation, and the palliative care ward in Westmead Hospital is going to be reopened, which is just wonderful news.
That is fantastic news.
Very good.
Great to hear.
Remind us why it was closed in the first place, Philip.
I was director at the time, and we kept asking that questions, and they came up with a lot of excuses that were not correct and not appropriate. And this is one of the problems in the health infrastructure, that there's not a lot of transparency there.
Yep.
The beds were moved to the cancer ward, and so the poor palliative care patients and their families were on an acute ward, which was not appropriate, the environment, the nature of the staff. And the palliative care nursing staff became so fed up that they all eventually resigned. And so there were no specialised palliative care nurses caring at the bedside for patients. And now the hope is that once the ward is reopened, it will not just be the physical structure, but it will be the staff that will be able to care for these patients. And in such difficult COVID times as well, the palliative care staff have done an amazing job supporting those patients and their families, unfortunately by phone and teleconference, during this terrible time. And these sort of issues are going to continue for some time, and let alone all the usual palliative care patients who have cancer, heart disease, kidney disease, etc. So it's just vital in a hospital like Westmead, the size of Westmead, that it has such a service, and we're just all thrilled that this decision has finally been made.
Well, you know, you ring at a very interesting time too, Philip, when the topic of palliative care is really in the headlines with, you know, this voluntary assisted dying bill that is entering Parliament in New South Wales. And there is a lot of discussion about palliative care. I mean, has it been modernising, I guess, the advances in palliative care? I mean, they're better than ever, and people often use this as an excuse not to back the assisted dying bill. Have you got any thoughts you'd like to add there?
Yes, well, it's one of the biggest concerns that I certainly agree, and the palliative care community in general agree, that one of the issues is that palliative care is still not well enough funded to cover those people whose lives are a misery, who are suffering and struggling through their end-of-life phase. And Western Sydney is a prime example of that, that when you compare it to the eastern suburbs, the northern suburbs, it is so underfunded and the resources are so much less that people are suffering. And you're not surprised when people will say, I just want to end this because my quality of life is so poor. And when you see, in my experience, when I saw patients who requested euthanasia, but you met their needs, you met their pain, their psychological distress, etc., they actually turned around and enjoyed life and wanted to keep on living. It doesn't solve 100% of the problems, but if you don't address the majority of the problems, there are going to be so many more people whose life and their dignity is going to be so poor. And hopefully this step will make a big difference to the people in Western Sydney.
Well, it is very good news, and we're very glad to hear it, Philip. Thanks for ringing in and letting us know.
Well, I just want to ask, Philip, would you vote for VAD?
Personally, I wouldn't, but that's coming from a palliative care perspective, and my experience is that the number of people who are following an intervention from the palliative care team have still requested euthanasia was literally, over my 20-year career, 2 or 3 people. Right. Those are the people who actually were able to access palliative care. And so that's the direction that I come from.
Okay.
But the reality is it may well go through and the palliative care committee will need to deal with that, but we can't neglect palliative care just if that legislation is passed.
Sure. All right. Well, thanks for revealing that. I'm just on a question without notice. Thanks a lot.
Thanks,
Thank
Philip.
you so much, Wendy and Robbie. I
Thanks.
appreciate it.
Bye-bye.
Dr. Philip Lee, who is the former Director of Supportive and Palliative Care in the Western Sydney Health District. And the news last night that it will be reinstalled.